what is a bladder infection or cystitis? Well, let's have a look at this picture of a bladder, eh? So you can see here a picture of a female bladder. It's deep in the pelvis, and it's just in front of the old vagina here. And you'll see the outlet, which is called the urethra. See that tube there? It's only really a couple of centimeters long. So a bladder infection is just the infection of the wall of the bladder, and usually this little urethra as well. On the other hand, this here's a male bladder, which again is obviously deep in the pelvis. And you'll see that the urethra or outlet is a lot longer because it goes down and around and then out the penis, which can vary in size from 1 centimetre to 20, depending which area of the country you come from. So how do you know if you've got a bladder infection? Well, the good thing about bladder infections is usually they're fairly obvious. Because the wall of the bladder is inflamed, it gets irritable, so you tend to find that you go to the toilet more often. And you get this urgency to go to the toilet, but you only go a small amount of urine or wheeze. The other thing is it's often painful to go for a wee, either at the outlet or in the lower part of your tummy, just down here. The thing to be aware of though is that if you get these symptoms and high backache as well, it could be that the infection's moved up from the bladder and it's in the kidneys, which is a lot more serious. So if you get backache with these symptoms, it's really important to go and check out with a doc as soon as possible. So what causes bladder infections? You can just get them, and it's just the way it is. But in young women, it's often tied up with sort of a frictional thing because the outlet from the bladder to the outside is quite narrow and short. Bugs can get pushed up there in sexual activity or even things like bush biking. In men, it's often tied up with guys who've got large prostates and their bladder's not emptying properly. It can be either a men and woman in diabetes because there's a lot of sugar in the urine and that predisposes and allows the bugs to sneak on up and cause infections. In children, it's often tied up with anatomical abnormalities where the whole bladder system's a bit skew-whiff and there's different leaky valves and stuff like that. So bladder infections in kids is actually quite important to pick up and investigate. So, treatment. How do you treat bladder infections? Simple, you just need antibiotics. They can be given by the practice nurse in the uncomplicated urine infections, or if there's issues with more complicated ones, the GP will give them. There's some common antibiotics. Most antibiotics that go through the urine will kill the bugs. If you get recurring urine infections, that becomes an issue and it has to be sorted out. But remember, the things that help prevent urine infections, good hygiene down below, good scrub up, if you know what I mean. If you're getting them after sex, then it's important to, have a pee reasonably soon afterwards. Don't ruin the moment and just jump up and rush to the toilet, you know what I mean, but within 10 or 15 minutes. And some people may say actually, and there's some evidence for cranberry juice in helping prevent them, not to treat them, but to prevent urine infections. So, drink a bit of cranberry juice as well, and also keep the hydration up generally anyway, and that's good for you.